Good day to all of you that are listening to this webinar. This is Chris Probasco. I'm a licensed clinical social worker in the Missouri-Kansas area and have been doing adoption and fertility work my whole career. I've had over 10 years experience. Actually, it's 13 years experience if we get to our exact timing of working with embryo adoption. My first embryo placement was triplets, and they're now 13, so I can keep track of all of the happenings that way. I'm so happy to be with you today, and we're going to talk about a hard subject. So if you're looking and listening and you need to take a pause and just take a breath as you get through this, because it is some difficult information to hear. All right, so we're going to begin. Slide, please. So when a family goes through infertility treatment and needs to move forward with an IVF cycle, and then creates their embryos that have a lot of hope for their outcome. And the embryos may be completely genetically related to the couple or partially if they use a sperm or egg donor. Next slide. So lots of thought goes into the IVF. I think when people think they're getting started with fertility, they think, "Oh, we'll never get to IVF. That's way down the road," but their journey brings them there. And the IVF process has an impact on a couple and individuals, as the slide says, physically, emotionally, financially, medically, their relationship, and spiritual. So the couple tend to take care of themselves during the IVF process and are very connected to all the embryos that are being created through this process. Next slide, please. So once the journey comes to an end, and that journey comes to an end in very different timing for each family, either that's through parenting or even a child-free infertility resolution, where they may have made embryos and they're not able to have the transfer. There's still lots of feelings of an investment towards those embryos. Oftentimes folks will say that we started with 10 and then we got down to 6, and they can say what the journey was for their embryos and have lots of hope. Those embryos, all of those embryos, represent lots of hope. Next slide, please. So it's very normal to have an attachment to each embryo. Sometimes they're named A, B, C, or D, and they know which embryos are being transferred, which it would be A or B or D or whatever. So the attachment is very normal, and the couples are attached to every one of those embryos. And their intentions is to parent those embryos, for those embryos to result in live children. And they also represent such hope and dreams for the future. Every embryo is precious, and folks are emotionally connected to them. Next slide, please. So due to the connection, there's a lot of intense emotions that one will have individually and as a couple. And then when they're in a position of trying that their family is complete, and then what are they to do with the waiting embryos? And I think for a lot of people, the decisions made when they create those embryos, and they want those embryos to be able to continue their lives, and knowing that they're not able to bring those home in their family, but they want a family for those embryos. So it takes a long process to decide, is there a right family for our embryos? Next slide, please. So are we on the same page? And I see this quite often, where couples may disagree in terms of the process, but not necessarily the end decision. So they both believe that they want these embryos to continue their life. However, the timing and the process can have some difference of opinions. And I think the best thing when I see people that are trying to make a decision is let's discuss this in terms of the needs of the children that you will be placing with the adoptive family. What do you want to provide to those children with the family you select? Next slide, please. So are we sure? I think this is an up and down decision. There's a reason that most embryos are frozen for quite some time before an adoption decision is made. I just received an article that had embryos frozen for 20 years, and they were successful in making children. So this is a decision that, again, I think it's already made, but then trying to get to the decision of I'm ready to go can be complicated. And you can redo, are you sure we can't have another child? Are we sure we don't want to bring more children into our family? So redo and relook at that. And it is a struggle. And the intensity of the emotions fit the decision that is to be made. Next slide. So why is this so hard? Well, of course it's hard because you are making the destiny decision for your little embryos that we hope will eventually become little people in their raising family. So it's easy to get stuck in, I'll deal with that tomorrow, but then months and years follow. And I think getting that storage bill from the fertility clinic is, awakening of, okay, is this the year that we need to make the final decision for the placement of our embryos? So it is hard. It is difficult. Give yourself credit for the difficulty that's present in really letting go of those embryos for being parented in your family. Next slide, please. So what is unresolved grief? And I think that does pop up when we are trying to make the decision, and then folks may just get stuck in those emotions and then, again, aren't able to move forward. So I see a lot of anger. We shouldn't have had to be in this situation to begin with. I never thought we'd have to do IVF. I treasure the children I'm parenting, or I treasure the opportunity these embryos give to another family, but still difficulty about being in this position. And then also a little bit of regret. If I knew better, I may not have created all those embryos. Oh my gosh, I remember when the embryologist and our physician said, we got all these eggs and they look all healthy. Do you want to have them all in the IVF process? And of course you do, because you want as many opportunities in the present and the future to fill your house with the children you desire. So, of course, you would make as many embryos as you can because you want all those opportunities. And then really sad that I have to wrap my head around that another family will be raising our genetic siblings, our children's genetic siblings. And, it does bring heartbreak. And just to feel the feelings and understand the feelings and process the feelings will unhook that unresolved grief, so you're able to make decisions that are sound and appropriate for yourself and your family. Next slide, please. So the impact of unresolved grief. I think the unresolved grief oftentimes gets stuck in what if. So I'm willing to let go of the embryos if I have only this type of family. I'm willing to let go of the embryos if they will agree to the process that I have in my head about when a pregnancy should occur. I want to be able to be part of the management of their cycle, so that I feel like I'm part of all of this, and wanting to control exactly how the adoptive family handles communication and such is really putting control. It's not, it's conditional letting go with the expectations that my needs will be met. And I think it takes a lot of grieving to switch that to the needs of the child. Um, so by doing the process, understanding the letting go, and I'm making plans that's the best for this child and the family they will be raised in. Next slide, please. So every individual will have a preference of the type of family that they're wanting, of course, and then, but to be unrealistic in choosing that family is again part of the unrelief guilt. So I think people look for people like themselves, maybe some of the same interest and values and stability, of course, for the of the intended parents. And those preferences, they fit. That's okay. But if we get too rigid with it, then that's maybe saying that we need to step back and take some more time before we're really ready to openly accept the families that are available for an embryo. Folks are not going to find families exactly like them, but maybe they can find families that have some of at least the core values and provide stability for the children. Next slide. Again, don't beat yourself up. I think I hear often from folks of, I need this is such an emotional process. Why is this such an emotional process? My physician's office is encouraging me to make this decision. The longer they're frozen, the longer they're frozen. But the true process of grief is to let go of you as parents of these children. You will always be their genetic first family. You are the family that made the decision of how they came into the world, and you're making the decision how they continue in this world. So there is nothing that will take that away. You have a genetic and emotional connection to these embryos that will become children, and that is all right. That fits the story, that fits the situation. Of course, there's lots of issues that the decision will, again, create, but having the faith that you'll be able to handle those. Next slide, please. So, again, take the time. We know it's a hard decision. I think a lot of the encouragement of being able to select a family is that the family that's going to be blessed with parenting a child. And yourself how hard it's been to have your family, or how hard it's been to let go of those embryos for another family. So they're of value, and the blessing that another family will receive is part of the satisfaction of we did everything we could to allow these embryos to be parented in a very well-suited family. Next slide. So, what if there's a pregnancy? When does it happen? How might I feel when I get the news of the pregnancy? That's, again, all part of the process. So you've made the decision, and then we're on the journey of what other feelings and emotions will come as the process begins. Now, most of the placing families that I work with really do want to know when there's the transfer is being they're in a transfer cycle, and they want to know if there's a pregnancy, so they know the outcome, and through in their own way, they will be supporting that child. Next slide. So how will I handle seeing pictures of the baby? Well, that has its own factors with it, but what I hear mostly is joy. My gosh, our giving has has continued the creation of this child, and seeing the pictures and knowing they're okay, and oh, how adorable that picture must be, and oh, they must have went to a lot of expense to get that picture. I know they love this child, and I want to join them in the love for this child. Next slide, please. What if the adoptive family has a girl or boy that they did not have? Now, that is part of the reality and the truth. You know, when you make those little embryos, you don't necessarily know if they're boys or girls unless you do pre-implantation genetic testing. And you may be parenting two boys, and then the intended family has a girl. Well, I guess that's an opportunity for you to purchase some girl things and send them to the raising family in behalf of their first family. So you still have a little girl to buy for, or you still have a little boy to buy for. It's just that you are giving to the child you helped create. Next slide. How do I handle updates and milestones? Well, you will keep in your mind. Your mind will be etched with the date of birth for your genetic person, and you will in your mind be saying, okay, now they're 4 years old. Okay, that's about preschool time. They're going to first grade, and there is some emotions connected to that. And this is what they are to do. This reaching their milestones is their job to do, and it may have a twinge of, okay, this is what the decision meant, and these children are growing and prospering, and it's a celebration. So yes, a bit of sadness and then celebration. Next slide, please. And how will I respond to the child if they have certain features that I just love? That's another celebration. The features in my child that that are so delicious, is what I say about my grandbabies, are just exciting. So so far I don't have a grandbaby that looks like me, but I have one that looks identical to my husband. So it's nice to see that our second daughter looks like him, and so they have one child that looks like her. Via looks like him. It's just a cause for pause. These are great looking kids, and they got great features, and that was part of the process of allowing this child to have their life. Next slide. There's no perfect answer, I think, in making difficult decisions. Nothing's 100%. So any decision you make is never 100%. What I tell families is that if they agree at least 80%, that it's best for these embryos to be placed with another family rather than continue to be in storage, then they work on the other acceptance as the process goes. So if they're as sure as they can be, 80%, and then they know that the rest of the process will enable them to get to at least as close to 100 as possible. But again, you're never 100% on anything. So the remainder of the thoughts and experience will be processed and will be processed over time. And I know Snowflakes is doing a really great job in helping the placing families and even offering them a counseling session if they would choose with a mental health professional to help to express the feelings and help with validation. I've really enjoyed this experience, and and presenting to you today, and I really honor your courage to consider placing your waiting embryos and finding the best family, and understanding that you gave all that you could to those remaining embryos for them to have a successful life. Thank you very much.